Welcome to the show, Dr. Nathan Barhama. He's a surgeon at New York's Mount Sinai Hospital and associate professor of medicine at Mount Sinai Medical School. And we bring back our old friend with us, health policy expert Betsy McCoy, author of the book Beating Obamacare. I want to begin with Betsy for a second, because Betsy, there's a lot of interesting stuff from this GAO study. And I'm just going to read one thing. If you're a 30-year-old in reasonably good health, okay, and you're making $35,000 a year, $35,000. First of all, you don't qualify for any kind of subsidy. Second of all, you'd have to pay $2,739 for the worst plan out there, and a lot of people think that just isn't going to happen. They will not sign up.
That's right. And let's explain what the worst plan is. It's a plan with a $5,000 deductible. So that young man who's going to write a check for over $220 every month is going to seem like he's getting nothing back, because a man that age doesn't even use preventative health care. So how many months is it going to be before that man says, well, instead of writing this check to the Obama exchange, let me make a car payment? One of the things ahead is a huge default crisis, similar to the mortgage default crisis or the college loan default crisis, because the assisters who are going to coax people to enroll in these plans are getting paid, in most states, $58 per enrollee. Never mind whether the enrollee is capable of paying the premium every month or intends to pay the premium.
Who's paying him? Who's paying?
The state exchanges are paying.
The state exchanges?
Yeah, well, the federal ones too. They're going to pay on a piece rate basis. So just like the mortgage bankers who encouraged you to sign up for that mortgage and there's no penalty.
A lot of these kids do. I mean, 35 grand is not a lot of money. They're not going to get any subsidies at all. So they need, my understanding is, and I want to get to the doctor in a second, they need 3-4 million young people to sign up to make the numbers work on the subsidies.
It's not going to happen. It's like selling flood insurance to desert dwellers. These young people have nothing to gain from this.
All right. Dr. Barhama, welcome to the show. The other side of the coin is it's bad for doctors. And the polling show today, there's a new poll out from Deloitte. 6 in 10 doctors believe they're going to be early retirement. Actually, the New York Times CBS had a poll today that showed 54-36 people disapprove of Obamacare in general. Why are doctors going to retire early?
The foundation of good quality care is the physician-patient relationship, and it is being undermined. It is under threat. Physicians, are there to advocate on behalf of their patients. The patients trust their physicians, and the way the system is evolving, that is being shattered.
Why is that? Give me just a quick, why is that relationship being shattered?
It's shattered because physicians usually do what they think is right. They want to prevent disease. They want to cure disease. They want to do diagnostic tests that are able to, help their patients. And when we become robots on an assembly line, where we're dictated what we can do and what we can't do, where the system is under such strain.
By some central planning operation in Washington, D.C.
Section 1311 empowers the Secretary of Health and Human Services to dictate how this doctor treats even privately insured patients.
Is that correct?
That is correct, and that's why 6 out of 10 doctors are going to retire. The system can't function if the main players, which are the physicians, are going to not show up.
Is it true, in your judgment, that the best and brightest young kids will not go into the medical field? They just don't want to do it.
They're smart. They hear our disappointments and frustrations. They know the investment is tremendous in terms of financial and time, and they just don't see the rewards of satisfaction and quality of life, compensation, and rewards that are emotional in terms of being a practicing physician being removed from the system.
All right, Betsy, I'm going to let you finish this up.
Well, by the way, these exchange plans are not the same as the plans people are buying from insurance brokers. If you sign up for an exchange plan, chances are you're going to have to drive right by a prestigious medical organization or hospital and a very prestigious doctor like this one, and go to a hospital and doctor that take cut-rate payments, similar to Medicaid payments. These are very small networks. So in Los Angeles, for example, Cedars-Sinai will not participate in any of the plans offered in the state of California.
So Bobby Jindal, Governor Bobby Jindal of Louisiana, is right. This is unworkable. That's really what you're saying.
Yes, it is, and it's very destructive of medicine.
That's what you're saying, too.
Yes.
Physicians are not going to show up.
All right, I wish we had more time to visit on this. This is a major issue. This thing will never go through. It's just not going to happen. Anyway, Betsy McCoy, thank you. Dr. Barhama, we appreciate it very much. Now,